Hello everybody, my name is Patrick Will. I'm the Peer and Family Support Coordinator for Spinal Cord Injuries Australia here in the ACT. And this is a presentation on pressure care, on pressure injuries, prevention and protection. Basically, the idea is just to give you a bit of a rundown on what pressure injuries are, how to avoid them, things like that. So I will just share my screen quickly and we will get into the presentation that I have. All right, so pressure injuries are arguably one of the most serious and common secondary health conditions that someone with an SCI can have. Up to 85% of people with SCI will have a pressure injury in their lives. Pressure injuries are serious and can be fatal. So knowing how to avoid them and how to spot and treat them if you're unfortunate enough to get one is really vitally important. This presentation aims to give you the information to help you do that. I should stress I'm not a doctor. I don't have any kind of medical experience. So this presentation will be coming from lived experience and really common sense stuff, as well as some resources that SCIA have put together over the last few years. If you have some more advanced questions, we do have Charbel from Coloplast, who is on hand to answer some of those and provide some more basic clinical experience. I want this presentation to be informative and interactive, so if you are in the room today, please, if you have any questions, just call out and ask, and we'll do our best to answer them. So pressure injuries, also called pressure sores, ulcers, areas, or wounds, are all used to describe changes to the condition of the skin. Who can be affected by pressure injuries? Well, really anybody can, but in this instance, wheelchair users and people who are bedbound are most at risk of developing a pressure injury. Pressure injuries occur when the skin and underlying tissue get damaged by constant pressure, laying or sitting in the same position for too long. Some of the early signs of pressure and changes to skin to look out for, you look out for red areas or pink marks on the skin, wounds or blisters, splits in the skin, bruises or grazes, things like that. Why is skin important? Well, we're covered in it. It's the largest organ in the body. It forms a protective barrier to protect the inside of our organs, to protect the inside of our body and our organs and blood. Prevents fluid loss from the body, regulates temperature, allows us to feel sensation, and our skin is moving all the time with us, which allows for good blood flow and oxygen flow throughout all the areas of the body. So why can pressure injuries be so dangerous? Once a pressure injury has formed, it can take months and even years to heal and can be very painful. And you can have ongoing issues even once the pressure injury has healed. I know this slide here says life-threatening, but I'm not going to use delicate language. They can be fatal, you can die, and people do quite often if they're left untreated. If they're not treated or managed properly, they can become infected, which increases complications and increases the risk of death. Signs of an infection can include fever, warmth, or discharge around the pressure injury site, and that's something that you really need to get checked by a medical professional as soon as possible. In severe cases, they can extend all the way down to the bone, and further on in this presentation, I do have some lovely images which will scar most of you for life, as they've done for me, which do show you how bad a pressure injury can get. In extreme cases, hospitalisation and possible surgery may be required, which does take months to recover from. And so prevention and early detection are the keys to lowering the risk of developing a pressure injury and avoiding further health issues. So specifically for people with spinal cord injuries, why are pressure injuries a problem? There are many secondary issues that come with a spinal cord injury that can increase the incidence of pressure injuries. They can include reduced mobility, which reduces blood flow, reduced or no sensation to many parts of the body, which is the big one. If you get a pressure injury and you don't have feeling there, obviously you may not know about it. Reduction in motor function, reduced balance, which can make it difficult to maneuver your body to spot where a pressure injury is. Poor or reduced circulation, poor ambulation movement, risk of falls, increased spasticity and spasms, moist skin as a result of sweating or incontinence, which can cause additional breakdown of the skin, unintentional friction of the skin, and burning of the skin by showering, sunburn, burning by hot drinks, etc., which goes back to the reduced or no sensation. So where do pressure injuries occur? Really any part of the body you can get one, but particularly bony prominences or areas that are under constant pressure that reduce blood flow in that area. So the buttocks, inner knee, hips, back, heels, or the rest of the foot, which is where I had a pressure injury a couple of years ago. Elbows, shoulders, and head are all particularly susceptible parts of the body. Any area that is affected by the spinal cord injury can be vulnerable. So that goes back to the reduced sensation part. The intrinsic factors include things such as age, nutrition, disease, stress, or lack of sensation or mobility. Intrinsic factors include such things as pressure, friction, shear, and moisture. So what are pressure, friction, and shear? So these are all forces that act upon the body and act upon the world. They're all major contributing factors to developing a pressure injury. Pressure is simply gravity acting to push your body in one direction, while the surface you're against pushes in the opposite direction. Most people know what gravity is. Friction is two objects rubbing against each other, so rub your hands together. Shear is pressure plus friction, and shear can be particularly dangerous in causing pressure injuries to open, which then leads to infection and further complications. So the following slide, this is what I mentioned before, does contain some fairly graphic images which show exactly how bad a pressure injury can get and talks you through the different stages of a pressure injury. So stage one, you've got intact skin. It'll be a red mark that will appear, and this is the first indication that you've got a pressure injury. And further on in the presentation, we'll go through some things you can do to test that. Stage two, partial skin loss. So that will be a shallow open wound. Stage three, getting a bit deeper. Stage four, that's where it's getting down to the bone, and that's a very serious situation indeed. That will require immediate medical attention. And then you've got deep tissue injury, sometimes also called stage 5, and then unstaged, which is very, very serious indeed. You're in big trouble if it gets to anything beyond stage 3 or stage 2 even, is a very serious situation indeed. We'll just go through these. So stage 4, fairly graphic. And then, yes, untreated is not good. So checking of the skin, how do you check your skin? It's important that all areas of your skin are checked 2 to 3 times a day. Again, this presentation says by yourself with a long-handled mirror or by a family member or carer. Not a lot of people may have a long-handled mirror handy to them, but I'm willing to bet that most people have one of these with one of these. And if you've got a smartwatch, you can actually live stream what's on the camera to your smartwatch. And that provides a really good way. Somebody can hold the phone and run it over your body. You can do it yourself. And it just provides a really good way of checking those parts that you can't necessarily see and making sure that there's no issues. Always check your skin immediately if you think it has been compromised in any way. And The blanching test is a critical part of checking the staging of the pressure injury. So it's a simple test where you basically push your finger on a suspect area. When skin is pressed, it normally turns white temporarily, and then once the blood flow returns, it returns to a normal color. If your skin doesn't turn white when it's pressed, this can indicate a skin problem, and you should consult a medical professional as soon as possible. So prevention of pressure injuries, and we have a lovely picture of our team member Dan here playing rugby. Strategies for prevention: change position every 2 hours in bed and every 15 or 20 minutes in the chair. So it may be as simple as just offloading the pressure. Be mindful of activities that could injure the skin, for example, high intensity sporting activities. Avoid heat injury, such as sunburn, hot showers, hot kettles, or anything that can burn your skin. Be careful transferring on and off equipment, such as commodes, beds, car transfers, other chairs if you do sport. Really any situation where you're transferring and potentially dragging your skin across a surface. Be careful with spasms, as if you accidentally knock your body into something, you can cause damage. And as we said before, avoid friction and rubbing on surfaces where possible. And the last one there is keeping skin dry and healthy by managing continence and sweating, because moist skin is at a greater risk of breakdown if there is pressure or friction or shear. So pressure relieving in your wheelchair, some important things to be aware of when sitting in a chair: proper assessment and scripting of your cushion and chair. That's a really big one. When transferring from your chair, don't drag yourself. If you're having trouble transferring, ask an OT or a physio to teach you proper technique that will help you. Undertake exercises as directed by your health professional. So as I said before, that pressure relieving, hoisting yourself up so you're moving around and releasing that pressure. Having the correct wheelchair for your needs, including it being regularly assessed that it fits you properly, and we'll go into that in a little bit more detail shortly. So having a proper pressure care cushion will greatly assist in reducing pressure injuries, and this is an area that I am more qualified in. I used to prescribe wheelchairs, so I'll just talk briefly about what the different kinds of pressure care cushion that are on the market. So there are 5 main styles. We have examples of 4 of them there. They all have advantages and disadvantages, and there are also cushions for the combinations of all 4 of those. So air cushions, such as Roho, are generally considered to be the highest level of pressure care, and they're probably the most common type of cushion for people with an SCI out there. They can have issues around maintenance. Making sure that they're pumped up properly and making sure they don't have punctures can be problematic and can lead to issues. Gel cushions, which is the cushion, the black cushion there with the red square on it. They have a slightly lower level of pressure care, but they are much easier to maintain. They can, however, be problematic in colder climates. So I know down here in Canberra, during winter time, gel cushions, particularly liquid gel cushions, can become almost like ice packs. They become very hard, and making sure that they're optimized, I guess, is an important step in making sure that they're doing their best job in preventing pressure problems. Gel foam, also known as memory foam cushions, another alternative, which another good alternative. They can break down though over time, and so replacing them is an important step. Honeycomb cushions, which is the pink and blue cushion there, maybe they don't provide quite as much pressure relief. However, they can be better posturally, and that can actually contribute to better pressure relief, and they're significantly easier to maintain. And then standard foam cushions, which I don't have an example of, are exactly what you think. They're almost no better than what's in your couch or your dining chair. They still will provide some level of pressure care over nothing, but are generally the cheapest cushion on the market for that reason. So as I said before, chair setup is really important, and even with an appropriate cushion, you can still be at risk of a pressure injury with a chair that is poorly set up. So a chair that's too big, too small, or not set up to your specific body can increase your chances of getting a pressure injury. For example, if your foot plate's too high, this can put greater amounts of pressure on your heels, or if your chair's too wide, you can fall to the side, increasing pressure on one hip, which can lead to problems. And even with the best pressure cushion on the market, you are still at some risk of developing a pressure injury if you're in a chair that doesn't fit you properly. And in some cases, the wrong kind of cushion, even a highly rated pressure injury one, can cause postural issues, which, if they're not addressed with other parts of the chair, for example, backrests or side guards or armrests, they can lead to pressure injuries in other parts of the body. So pressure relieving in bed, remember that we spend about 8 hours of the day asleep in bed, so you want to make sure that you're not developing any pressure injuries there either. So turning regularly in bed or just moving around, not lying completely sedentary all night long. Using the correct mattress, whether that's an air alternating one, if your pressure care needs are that high, or a good quality memory foam one. The correct bed, so whether you need a bed that has movement in it, so tilt, leg elevate, head elevate, things like that. Correct positioning in bed, so example there, lying in a good position to alleviate pressure in as many parts of your body as possible. Again, not dragging yourself across the bed, moving in a way that reduces your chances. Trying to keep a pleasant temperature in the bed, so avoiding sweating, and also, again, incontinence, things like that, keeping a dry, pleasant temperature, and again, avoiding rubbing your skin bed to avoid chances of it opening up and causing problems. So clothing is another area which is very important. So avoiding clothing and shoes that rub or are too tight, and that's where I fell foul. A few years ago, I was wearing some boots which were far too tight for me, and I developed a pressure injury on the bottom of my big toe, and that took quite a while to heal. That I was in hospital for a while and off work for probably a month or so. So definitely avoiding clothes that don't fit you properly, or have seams or things like that is a big thing. Ensuring your underwear is positioned correctly, again, avoiding seams and things. Removing your orthotics if you're wearing them periodically throughout the day to prevent rubbing injuries on your calves. Keeping your clothes from bunching up or wrinkling in areas where there's pressure, so you're not having a spike in one particular spot caused by that seam. And one that I know I'm guilty of almost every single day, checking for items that are in your back pocket or you've left on your cushion. I leave my keys or my wallet or my phone on my cushion almost every single day. And after half an hour or so, I'll go, that feels a bit odd, and I'll reach behind it and grab my wallet out or something. There are several other important factors that can help in pressure injury prevention, aside from what we've gone through already, and they're really just common sense things for everyday life and everyday health, really. So nutrition, so diet and fluid intake are most important. So keeping healthy and keeping your skin healthy plays a big part in preventing pressure injury. Age, which there's not much we can do about, but being mindful of, as we age, our skin loses its elasticity and is more easily damaged. Stress can assist with the prevention of pressure injuries as well, just again, general health and well-being. Pressure is a fairly obvious one. If there's no pressure, you won't get a pressure injury. Friction, again, avoiding that by avoiding running your skin across surfaces roughly, so lifting off. Moisture, which we've gone through, avoiding unwanted moisture through sweating, dampness after a shower, and incontinence. So educating your carers. As someone with a spinal cord injury, it's really up to you to be the boss of your own healthcare. You know your body best, and you need to educate people who are looking after you in how to look after you the best. So ensuring you give your carers an up-to-date pressure injury prevention plan, which we'll go through in a second. Ensuring they're careful with transfers, ensuring they wear gloves and don't have sharp nails, rings, or anything that can potentially cut you or damage your skin. Making sure that carers check your skin properly, so do a very thorough job of checking your skin, not just a cursory glance. And helping you to ensure that your skin is kept at the correct moisture, especially in winter when dry skin often occurs. And I guess the thing to say here is that the higher your injury, the more likely you are going to be relying on somebody else to do these things for you. And conversely, the more likely you are to get a pressure injury. So the higher level injury you are, the more important it is that you do have a very solid plan with carers that you trust and know will be able to look after you effectively and safely. So pressure injury prevention plan, it's a document that states clearly the strategies you have in place to prevent pressure injuries and the process to follow before, during, and after the event of any injuries. It's vital to have a prevention plan so that it's clear to all carers and staff what process and strategies need to be followed to prevent pressure injuries and what to do if you are unfortunate enough to get one. So putting together your plan can be done with your OT, GP, or other allied health professional based on the risks associated with your injury. You should get a 6-month review of your prevention plan, get a regular review of equipment to ensure that it suits your needs, and get a regular spinal specialist review as well. So this is an example of a pressure injury prevention plan, and just goes through some of the things that you can do to personalize it to make sure that it is suitable for you and does the job that it's required to do. Just give you all a chance to read that. So a daily checklist is another thing that your carer can tick off each day. And it's important in making sure that your plan is followed. So some of the things could include, but don't necessarily need to, turning every hour in bed, lifting off your chair, so as I showed before, changing your position, setting alarms on your phone as a reminder for pressure relief, checking skin integrity, either done by a carer or by yourself if you're able to, checking your fluid intakes are adequate, and as well some of the other things I said, so making sure your diet and your movement is adequate as well. So some other considerations to keep in mind, be very careful of accidental knocks and bumps. As we have spinal cord injuries, we can't necessarily feel these things, but that doesn't mean that there isn't issues that have been caused. Watching for bruising and scratches that can lead to further problems. Burns caused by hot liquids have the potential to cause pressure injuries as well. Checking for insect bites, spots and pimples. Again, anything that may potentially cause a breakdown in the integrity of the skin, which can then be compounded by pressure. And once you've had a pressure injury, your risk of developing further pressure injuries increases. Scar tissue that heals isn't as elastic as it used to be, so be careful. So if you suspect a pressure injury, what should you do? Have your carer photograph the site morning and night to allow for detection of changes. The main thing is get off the area as soon as possible and use some pressure relieving equipment such as a medicated inflatable ring. Check and double check. Once you have a pressure injury, that sort of becomes issue number one, and it should become your priority to constantly be monitoring it. You can photograph the area against a coin to show its relative size and check for redness. Perform the blanching test. So as we said before, pushing on it, and if it doesn't return to normal, then that's a serious problem. If after 2 hours the redness has not improved or is getting worse, then seek medical attention at your nearest hospital. And in this photo here, obviously we can see that there is an open pressure injury, so that would be a significant cause for concern. So as we said, get off the affected area immediately. Relieve any pressure from the area, so that includes clothing as well. Reduce the time pressure is applied to the area. Resolve the cause of the injury. So that in that case, that might be the cushion you were using, or it might be the bed. So looking for that root cause and fixing it up. Developing a pressure injuries prevention plan if you don't have one already. Ensuring all your equipment is maintained properly. So as I said before, things like cushions, making sure they're properly inflated or in good working condition. Ensuring your clothing is functional for your injury, so it's not tight or restrictive or prone to causing sweating or things like that. Checking your skin regularly, at least twice a day. Having lots and lots of water and a very nutritious diet to aid your body in its recovery of the pressure injury. And as we said before, taking a photo of the initial sore against a 10-piece coin or other coin for comparison later, so you can see how it's tracking, whether it's getting bigger or smaller. And at that point, I will get our friend from Coloplast here to do a quick demonstration of some of the products that they have, which can assist once you have a pressure injury in terms of helping it to heal. So I will stop presenting. And pass it over.
All right, thank you very much, Patrick. So pressure injuries. So obviously we've got 4 stages and there's 2 categories. And so you got your stage 1 to 4, which Patrick covered really well, where you go from just a red non-blanchable site all the way to bone, tendon and muscle. And then you've got 2 other categories, obviously, which are unstageable because you can't see the base of the wound. So I'll just give you a quick overview of some of the dressings that we can actually utilize in these scenarios. Okay, so just make sure that you guys can see. So can you see that? Yep.
Yep.
Just to make it a bit easier. Okay, so first off, so if we're going to have a stage 1 pressure injury, obviously we want to get pressure off the site. That's the main thing we want to do straight away. But we also need to protect the skin. So we can't leave the skin just bare and exposed to more shear and friction. We do need to aid the skin in helping it heal. So I've got these dressings here, which are called our Comfil. So they're actually two different dressings. They are of the same category and same class, but one does different things to the other. So usually with the stage 1, we say to go with this dressing, which is the Comfil Plus Transparent. So this one is a bit more see-through, and you'll see when I take it out of the packaging. We also have this one, which is the Comfil Plus. So it's not as transparent as the first one that I just showed you. It's got alginate in it, which is a plant derivative, and it helps with hemostatic properties. So it allows you to stop bleeding at the site. However, if you've got stage 1, you won't have bleeding because there's no broken skin. But just wanted to tell you the difference between the two, because you might see these and think they're the same dressing, but they are different. So usually with stage 1, we like to go with the transparent one. So I'll just show you something really quickly. So with the transparent, so it's a hydrocolloid dressing, which means its adhesiveness is actually pretty good. And it's just like another protective skin layer. You just need to be careful with the skin integrity of the patient with this dressing. So we say utilize it for stage 1 and early stage 2, but do make sure that the dressing, that the skin integrity of the patient or the person that you're caring for is of good nature. Okay, so if the skin integrity isn't good, we'll refer to the dressings that I'll go over at a later stage now. Okay, so with these, obviously, you've got your teal touch point, which is here. So always open the dressing at the teal touch point. And with the dressing itself, it's always good to warm these dressings up. So when I say warm it up, it simply means in the packaging, you can rub it in between your hands or leave it in your pocket for a couple of minutes before you actually dress the site. So with the dressings, there's a 3-piece backing. So as you can see, I'll take off the first piece. And that's the first piece gone. I'm just waving it around so you can see it, because obviously it's a bit hard to see on camera. Then you use the 2 wings on the side, because you don't want to touch the base of the wound or the inside of the wound. So that way you keep an aseptic technique, which means that any of the bacteria or anything on your fingers is not affecting the wound bed, the exposed skin, the exposed part of the wound, or any kind of broken skin. But obviously with the stage 1, we don't have broken skin. So as you can see, I've just put this onto my brochure just as a demonstration tool. But you can't really see it, right? So it's very see-through. Okay, the only things you can see are these little parts here, which obviously sometimes you get a bit of funneling in the dressing, but if you put your fingers over it and rub with a bit of love, the heat from your fingers will help it stick down and you won't get that bubble. It's like when we used to laminate our books in primary school, which we don't do. I don't think they do that anymore, but back in my time. So as you can see straight past it. So you can do your checks 2 to 3 times a day, okay, on that site. Removing it, like I said, you need to think about the skin integrity of the person that you're caring for. So removing it is not always as easy, because what will happen is the heat from your skin, so from the patient's like body heat that is, transported through the skin will help this to stick down a bit more. So after 3 to 4 days, it could be, because there was so much heat there, it could be stuck on quite well, because these are shower proof as well. So they're shower proof as long as the edge of them is sealed really well. And like I said, you just need to keep rubbing on it just to make sure that there's no bubbles or anything else like that. And from a manufacturer point of view, it can stay for 7 days. So this is a 7-day dressing. Okay. And the great thing about it is because it can stay for 7 days and it is shower proof, it's pretty likely that you'll keep it on there. And because you can also do the checks 2 to 3 times a day because it is transparent. So it's really, really good. In terms of taking it off, I always say, every time I go into a hospital and ask a nurse to take this off, a lot of them do this. So they pull it off like it's a wax strip. Probably not the best thing to do, especially because, like I said, after a couple of days, the heat from the skin is going to help it to adhere a lot more. So you don't want to be waxing your patient. And like we said, skin integrity is key here. So there's 2 things you can do. One is place a little bit of pressure on the site of the wound and then pull away. As you can see what I'm doing, I'm pulling away and I'm going in a round motion. And that's just helping to make it a little bit more opaque, the dressing. And therefore, you're not waxing the skin off. See how it just comes straight off? So obviously, if you're right near the edge, because this is stuck on paper, it's a little bit harder to get off. The other thing you can do is, whilst utilizing this technique, you can also use a skin wipe just underneath as you're pulling, and that will help to loosen up that adherence. Okay, so you pretty much just keep going around, and as you can see, you wouldn't be able to reuse this dressing because now we've kind of stretched it out, and the integrity of the dressing is now gone. Where if you did it the other way, where you just pulled and waxed it off, it would cause a lot of harm to the patient. This will still cause not so much pain, but discomfort when you're taking it off, especially if the arm has hair on it, like mine. You will get a little bit of discomfort, but like I said, it's a lot better than pulling it out, pulling it like a wax strip. Okay, and the benefits of this dressing is the fact that you can see through it, and it acts like a second skin, and it helps with that shear and friction that Patrick was speaking about previously. Okay, so when we talk about its where is it? Yes, its sister product. So this one, which is the one with the alginate and that can help stop bleeding. This is the one that you can use on an early stage 2 if there's any fluid or bleeding, just because there's a partial loss of the dermis in stage 2. So it is open, and it's really, really, really vital that we protect that site, because, as Patrick stated, it is prone to infection. Okay, so it's the same technique that we say to utilize for this dressing, where you pull it off the same way I just did. And obviously there's the 3-piece backing on it as well. So as you can see, you've got your 3-piece backing. We take that off, we stick it on. This one, because it's a bit thicker, it's a little bit easier to stick on because it's a bit of a thicker dressing. But like I said, we don't want to be waxing it off like that. We want to be pulling, so pressure on the thing and then pulling around. Okay, and obviously, because I'm doing this on a catalog which is very flimsy and lifts up, yeah, it's causing the catalog to lift. So if you had it on skin, it's a little bit different. Okay, but that's the technique. So just pull away, don't pull up. See what happens? Pull away. Okay. And this is the same. This can stay up to 7 days. All right. Any questions on that dressing before I move on to the next one? No? Patrick, do you have any questions? No?
No, not for me.
No, not from you. All right, now I have our tool, so our demonstration tool, and this is what I'm going to utilize for our Biotane silicone product. So this is a silicone-based product. It's a really, really comfortable dressing. It's quite flexible when you put it on certain sites, and it's just really comfortable. I've actually worn this for 2 weeks just as a test, and I wore it with a competitor product, and this one was a lot more comfortable. Okay, so what I'll do is I'm just going to so this blue stuff that I'm putting in is just, it's supposed to replicate exudate. And the reason why it's blue is because we are Coloplast and a lot of our branding is blue, but also so you can actually see what's happening. If it's a clear exudate, it's harder to see. So like we said again, you use your teal touch point to open up your packaging. You've got your Biotane silicone, you've got your 3-piece backing, which is for aseptic technique. So we're not touching the dressing, and then whatever is on our fingers is obviously going onto the base of the wound. So with silicone, sometimes it's a little bit difficult to put it on because as you can see, it lifts quite a lot. And because I've got exudate sitting in the cabin, I'm trying not to move it around too much, but see how I'm giving it a little bit of loving? So applying some heat around the border, getting rid of any like little bubbles that might occur. This just helps with it adhering onto the skin a lot better. Because the last thing you want to do is to dress your pressure injury or wound, any wound in that fact, and then have it come straight off. Okay, so you do want to just give it a little bit of love around. As well as pressure injuries, this is really good for skin tears, and you did mention skin tears in the PowerPoint, I noticed. So it's a gentle adhesion and it's fantastic for fragile skin. And yeah, so for skin tears, it's great because obviously when you're pulling off a dressing off a skin tear, you don't want to pull off a flap that's there. So this is really, really good. Okay, so I'm going to let it work for 2 seconds. I've put quite a lot of exudate in here, so I'll let it work for 2 seconds. The sister of this product is our Biotane foam. So it's got the same technology as our silicone, but it's a foam concept. Okay, so it doesn't have a border. This is for really, 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 really fragile peri-wound skin. So skin that can't cope with any kind of adhesion. This is the one that you would use. Okay, it's the same kind of concept to a silicone. However, it's more of a foam, so you can cut it and manipulate it a little bit more. And then obviously the best thing to do with this one is to tape around the edges. So with it, whatever adhesion that you're going to use, if it's a sensitive tape or even if you're just going to do a crepe bandage on top, okay, just to protect that peri-wound skin and make sure that you're not causing any more damage to the patient's skin. Because I've had patients, because I am a previous nurse, which as soon as they hit their leg into something like or skin in general comes in contact with anything, just a minor bump can just cause the biggest skin tear. So yes, so we do need to be mindful of the skin integrity of our patients. All right, so I'm going to pull this off. So as you can see, what's happened is it's pretty much replicated the wound bed. Okay, so it's soaked up all the liquid that was in the wound bed, and then it has conformed. If you can see, it's kind of like created a bump there. Okay, so on its own, it's soaked it up and conformed to this wound bed. And the importance of that is the fact that every wound that we have, so the deeper that it is, the more exudate and the more fluid it will give out. Okay, it will release. The worst thing you want to do is put a dressing on which is not compatible with soaking up that fluid, because what will happen is the dressing will just sit on top, and what you have in this cavity will tip over this edge. And when it tips over this edge, it's like when you're in a bath for a really long period of time, your skin starts to go white and really, your skin kind of looks like it's about to break down because it becomes a lot more fragile. Same kind of thing happens around here. So that moisture and all that fluid in here then topples over to this part of the wound, and then you start to see something called maceration, which is the breakdown of the edge and the peri-wound skin. So when we talk about a wound edge, we're talking about this part. Okay, it's kind of like the cliff before you get to the wound bed. The peri-wound skin traditionally was 4 centimeters around, but research has shown now that they are classifying the peri-wound skin as 10 centimeters around the around the actual wound edge. Okay, so these are vital components that need to be looked after as well. So I know that we talk about the pressure injury itself, but everything around it needs to be looked after as well, because obviously it's kind of like a domino effect. If you don't look after what's around it and you're working from inside, you're just going to create damage around here. Okay, and this dressing helps to pretty much prevent that. Okay, so like I said, it conforms to the wound bed. Okay, so it kisses this wound bed, which not every silicone on the market does that. This is a unique technology to Biotane silicone, okay, to a Coloplast product. It absorbs the exudate vertically, which means it just absorbs it straight up. It doesn't absorb it and then spread it out, because when it spreads it out, it hits this part. And because it's spread out and hitting the wound edge and peri-wound skin, it causes that maceration that I was talking about, the breakdown of the skin because of the moistness. Okay, and it locks in the bacteria and exudate into the actual dressing. Okay, so there are major benefits with using the correct dressing, because you're going to create a faster healing environment and an optimal healing environment. So that's our silicone. Any questions on that? Nope.
No, not for me.
No? Okay, perfect. So I'll just show you with our Biotane foam. Okay, so this is the one without any adhesion. This is for very, very fragile peri-wound skin and for under compression. You know, when you've got those compression stockings. Yep. So what I'm going to do, and I'm going to do a smiley face because I want to show you that if you have 2 or 3 wounds in a very close proximity to each other, I want to show you that that vertical absorption property that I just told you about, the fact that it doesn't spread, it just stays in that spot, so that way you're not causing damage in that peri-wound skin area which is surrounding the wound. Okay, so this is a way, it's just to replicate the compression stockings that some patients come out with out of hospital or during their wound care management. So I'll just press on it. So can you see that lift in where I'm pressing?
Yep.
So that is that 3D fit conformability that you got out of the silicone. So as you can see, once again, it will kiss the wound bed. So you won't get any fluid building up or any exudate building up in here, which is really important for the exterior and the peri-wound skin, which is therefore important for faster wound healing. Okay, so this is the same kind of technology in this dressing. So what do you think about that? Any questions about this one as well? No?
Not for me, no.
No worries. So to sum it up, our portfolio, what we do is you got your Comfil, which you use for stage 1 and stage 2. The more transparent one you use for stage 1 and stage 2. The less transparent one, there's no need to use it until there's a stage 2, until there's any kind of broken skin. That's when you can that one. And just remember, 7 days shower proof. Okay, you've got your 3-piece backing at the back to make sure that you apply it without actually getting any bacteria on the inside of the wound, which will touch the skin and the wound bed. And yeah, like I said, 7 days, pull it off, don't wax it off. Okay, so pull away from the wound bed, from the center here. To pull away, don't pull against. Okay, because you don't want to wax that off. And skin integrity is vital. Always assess your patient's skin integrity. With our Biotane silicone, like I said, you can use this for stage 1 to stage 4, even the other 2 categories to protect them as well. Okay, but you just need to make sure that there's enough overhang in the other 2 categories. So there's enough overhang. When I say overhang, I mean that the border, the adhesive border, is sitting a little bit away from the wound center. Okay, from the wound bed in the center. Okay, this can also be used for up to 7 days from a manufacturer point of view. However, a lot of hospitals will tell you to change it every 3 to 4 days. It's not see-through, you know, so you do want to see what's going on underneath there. It is shower proof as long as your edge is put down on the skin without any funneling. So there's no bubbling or anything here. It's nice and flat onto the skin. You've created a nice seal, therefore you can shower with the product. It might just puff up a little bit, which means that it's kind of just the steam and the moisture has created a bit of a puff up nature for the exterior of the dressing. So you just pat it down with a towel. And this can conform to up to 2 centimeters. So 2 centimeters deep is how far it can actually go. Okay, when it gets further than that, that's usually a stage 4. Stage 3, stage 4, you need some kind of filling dressing. Okay, and then we have our Biotane Non-Adhesive. Okay, so this is the same kind of concept. This is actually shower proof as well. I know people don't believe it, but it is, as long as you window it in properly. So when I say window, it means as long as you put a certain type of adhesive tool to lock down the edges with no funneling, so no bubbling. It's just nice and flat onto the skin. So if you've created that seal again, okay, same kind of thing, conforms to up to 2 centimeters, vertically absorbs, and as you can see, does not laterally spread because we still have a smiley face. And this also will allow for comfort with your patient because it's quite flexible and soft and nice to have on. I'll just show you really quickly the fact that it is that the exterior of the dressing does repel. Okay, so it does repel away, it does not absorb. Where, as you could see on the other side, you can see this little part here where it kind of the fluid went in, because obviously we haven't taped the edges. That's what I mean by you have to window it in to protect it. See how it's bumped up because it's absorbed the fluid, but it hasn't bumped up on this side because it hasn't absorbed anything. It's just repelled it. Okay. And I think, look, in terms of pressure injuries, they're the three main dressings that we speak about. Because they're quite accessible within the hospital and through all the independent suppliers, like Bright Sky, IA, all that kind of stuff. So yeah, they're the usual ones. There are other ones in the portfolio which are for more complex, very deep pressure injuries, but I thought I'd just show you the basics today, just to kind of allow you to relate to the wound management that we do try and put forward. Okay, any questions with that?
Not from me, no.
No. Any questions overall about pressure injuries or? No. Awesome. Then my job is done.
Thank you, Jabra. That was excellent. Thank you.
No worries, Patrick.
Very good presentation on some of the different products that Coloplast have. I'm helping when you do have the unfortunate experience of getting a pressure injury. If there are no questions from the few people that we have here in the room today, we might finish up there. Thank you.
No worries. Thank you, everyone.